thank you. Do we have any questions for Dr. Gremillion or in general? Okay, so do you want to sit down, Dr. Gremillion, and then we'll open it up for the panel. I'll give you guys the mic so you can answer that.
Okay.
Anything? All right, yes, your question.
Hi, I'm Karen Howard from Mental Health America, and we're actually co-hosting a briefing next week which will talk about firefighter suicide. And we wanted to just ask and see if there were, from your experience, either data or anecdotal evidence of firefighters, their access to firearms, and the higher rates of suicide that we're seeing over the last couple of years in the communities. And even firefighters have reached out to me and my organization asking for help with some of the burnout, stress, and other mental health conditions that they may be going through with respect to personnel issues. So do you have any thoughts about or data about firefighter suicide and potentially the increased access to lethal means?
Do you have stuff to speak about? Well, I'm going to speak more about things that I've seen in the fire service, especially not even just so much in the FDNY, but being a member of the IABPFF. Some of the things that we've seen, especially dealing with suicide and dealing with a lot of issues, we've seen more of an uptake in alcohol and drug abuse, which is leading down to that path. And we've been encouraging the FDNY to take a look at some of those things, and they just kicked off an opiate program that they're looking into. But we're dealing with a lot of issues with firefighters that are dealing with, especially women and a lot of people of color, we're dealing with discrimination and racism and not knowing what to do with it or how to address it, or how the fire departments as a whole are addressing these issues. So a lot of them are turning into a lot of different means that are thoughts of suicide and drinking, alcohol abuse. But I know that just in some of my readings, and one of the links were included inside of the presentation that I did, there is I know more recent update that talks about the suicide rate, because I know back in 2017 the rates of line of duty deaths were less than suicide rates, and I'm pretty sure it was the same thing in 2018 as well. So statistically I don't have the data, but I know just from experiences and talking with people in the fire service, it is a really big concern that we have, and an issue that has to be addressed.
I don't have the data at hand either. I don't know if Kenny, if you know offhand, we certainly can look that up. It's not, hasn't shown up in our most recent mortality studies, but I think it's probably one of those issues that's an increasing problem that we're just going to see more of. So certainly the psychosocial stress factors are absolutely increasing. So I wouldn't be surprised if we'd see it show up in the data in our future studies.
Colonel, you were talking about kind of the risks with microbes to first responders, but kind of transferring that over to your talk on nurses. How hard is it dealing with infectious diseases such as the ones that the Colonel mentioned when they come into an emergency room?
In the emergency room, we are one of the largest intake throughout the hospital, so anything essentially could walk through the doors. As nurses, we try our best to use personal protective equipment like gloves, and we hand out masks in the waiting room. But essentially, as my role as a triage nurse, when I'm intaking patients and asking them questions, I am essentially at risk of whatever is walking through the door. But we, as healthcare professionals and providers, take on that risk. And as the Colonel was referencing, I think the duty that we feel and the call to serve is a risk that we're willing to accept as providers. But we try our best to use gloves when we're working with patients and hand out masks in the waiting room to help decrease the spread of disease. But there is a risk at being a first responder. So you never know what's going to walk through the door and what you're going to interact with. And sometimes you don't know until much later on that that person was carrying something or that you were exposed. And I've had many colleagues and many friends that have had to go on HIV prevention medication or hepatitis prevention medication because they were exposed to certain risks. So it's kind of the risk that we assume, but we see our greater good as a more meaningful purpose. Anything to add, Colonel?
Can't add to that. Good response.
Thank you.
Any other questions? Okay, great. Well, please join me in thanking our esteemed panel here today. I want to thank all of you all for joining us, and especially for our co-chairs, Congressman Whelan and Payne Jr. If your boss is interested in joining the Men's Health Caucus, please do reach out to Taylor Hiddle from Congressman Whelan's office or Stephen Schultz from Congressman Payne Jr.'s office. Our panel will be here for a few more minutes in case you have any specific questions you want to ask them. Aside from that, I see there's a few more bags of lunches back there, so if you didn't grab one when you first got here, then grab one on your way out. Thank you so much.